Before surgery, patients should make a plan for themselves. What do I need to make it out of the hospital and make it home safely and progress with my recovery safely? Step number one, look around your house. See if there's any loose rugs, any loose wires that you may trip on. You're going to be using typically a walker afterwards. You're going to be limping and you're not going to be as strong or as balanced as you were before surgery. Step number two, prepare your family because you're going to need help. You might be able to be okay by yourself during the day and sleep overnight, but you're not driving for several weeks, depending on the side that you're doing and amount of medications you're taking. You need somebody to be able to support you. Typical discharge will require you to have somebody at home to stay with you for a few days, make sure you're okay at home. So if you don't have that set up, it's going to make it a little more challenging to make it home, and most people do better when they go home rather than to rehab.
Hip replacement surgery can sometimes be done within a couple of weeks of the appointment when a person decides that they want to have it done. It just really depends, again, on the scheduling and how much evaluation they need ahead of time by their medical providers. For instance, if a patient sees a cardiologist on a regular basis and maybe has to have a stress test done first, then obviously we have to allow time for that. But sometimes we're able to actually have the surgery scheduled within a couple of weeks.
If you're coming in to schedule for surgery, it takes upwards of a month to get through the clearance process and as short as 2 weeks. If you're planning this operation, come in at about a month, talk to the doctor, get signed up for medical clearance, possible cardiology clearance, blood work, maybe x-rays, EKG, and depending on the patient's medical conditions and the doctor's schedule, it can take sometimes longer.
Following a total hip replacement, there are some things that you can do to get your home ready to make it easier to maneuver around with either a walker or crutches, whichever device the physical therapist deems is most appropriate. We ask that you look around your home and kind of identify any obstacles that may be in your way that limit your path into your bedroom or bathroom. We also ask that you remove things such as throw rugs and tuck electrical cords, against the wall or behind furniture. Kind of look around your home and see what items are stored low or on the floor, because bending will be limited after your surgery, so you'll need those items brought up onto a higher surface so that you can access them easier. The other things to consider are seat heights. Following your total hip replacement, you won't be able to go down onto a low surface. Standard seating is 15 to 18 inches high. To tell if a surface is high enough for you, you would back up to the seat and make sure that the seat of the chair hit above knee level. And that's typically high enough for you so that when you come from sitting to standing, you won't be breaking your total hip precautions.
To prepare for your hip replacement surgery, you want to strengthen the major muscle groups in the arms and the legs. You could start out with doing some arm curls or arm raises, and you can also work on some leg exercises. One leg exercise in particular is leg lifts, so that is lifting your leg off the bed, keeping your knee straight. These will all help prepare you for your surgery.
The biggest precautions that people need to take before surgery are to make sure that they don't come in with an infection, make sure that their respiratory system is clear. Someone who is a smoker, we strongly encourage to try to quit smoking at least for the 2 weeks before the surgery, because that has been found to benefit a patient from the standpoint of not having a respiratory complication. We also want to make sure that a person doesn't have any open areas, open cuts or wounds on the extremity that we're going to be operating on. So the person needs to be in as optimal health as possible prior to the surgery. Again, a diabetic should be under very good, tight glucose control to help prevent a complication.
Precautions before surgery include medications and activity. Medications, you should not be on blood thinners, and you should talk to your medical doctor or cardiologist for the duration of stopping those medications. You should not be taking any anti-inflammatory medications over the counter. These may include Advil, Aleve, ibuprofen, Motrin, etc. These should be stopped within about 10 days, including aspirin, of the operation. If it's far enough before surgery, you should try to do some home exercises to strengthen up, and we have those available for your review.
Your preparation for the day of surgery actually begins the day before surgery, when you'll do at least one, if not two, preoperative scrubs. Nothing to eat by mouth after midnight on the night before your surgery. On the day of surgery, you'll usually need to have another preoperative scrub. You may be instructed to take some of your regular medications, but the main thing to remember is nothing to eat or drink for breakfast, and then arrive on time for your surgery.
Before surgery, patients need to report directly to the registration desk area. From there, they will be taken directly to the pre-admission testing area.
In pre-admission testing, the patient has an interview with a registered nurse. At that time, they have a chest x-ray, an electrocardiogram. They may do some blood work there. They need to bring in a list of their allergies and a list of their medications, including what the medicine is, what the milligram is, how many times a day they take it, who the physician is who prescribed it, and the pharmacy's location and phone number, so that if they need to prescribe medications, they have that.